Oral Health Education Series, Module 6, Motivational Interviewing, Part 2. Hi there, Dr. Brecky again with Ready, Set, Smile. So, let's review what we talked about last time. Well, it may come as no surprise, but humans have very, very poor oral hygiene behaviors. So, how do we change behavior? Isn't that our goal? No. Remember, our goal with motivational interviewing is to help others want to change their behavior. And this can be achieved through, like I said, motivational interviewing and oral health education. It requires both. So why does this matter to you? Remember, you are the educator. Additionally, motivational interviewing is a tool for helping others to find their own path to behavioral change. It's not the only tool for helping others, but it's one of the more useful ones, and that's why we're going over it here. So some key things to remember. First, understanding cultural competency. And 2, recognizing health disparities. Remember, different people in very different situations require vastly different solutions for achieving behavioral change. Thinking about things like a person's culture and other health burdens that they may suffer is key in helping them to find their path to success and successful change. So what exactly is cultural competency? Well, differences in cultures, backgrounds, customs, norms, and behaviors influence our communication, interactions, and importantly, in this case as well, behavioral change. It is understanding and communicating effectively with people of different cultures. Not only is it understanding their culture and their cultural norms, but it's being able to really communicate with them. And sometimes there's a language barrier. So we also must consider the social determinants of health. Remember, these are socioeconomic conditions, cultural norms, segregation, discrimination, language and literacy, religious affiliations, access to educational or work opportunities, access to healthcare services, and accesses to resources necessary for daily living. These are determinants of overall health. So how exactly do we become culturally competent? Well, eliminate your inner biases, educate yourself, and ask questions. It may not be as easy as it sounds because we as humans do have inherent biases, ones that we often don't know that we have. Cultural competence is an ongoing process, and positive attitudes are really essential. Ask questions when you don't know. Try to educate yourself. These are really, really key in becoming culturally competent and effectively communicating with others of other cultures. Particular groups experience a disproportionate burden of disease, and preventable differences in the burden of disease, or ability to achieve optimal health, are also called health disparities. So remember, different people in different situations may require vastly different approaches to prompting communication and prompting change. So we'll get back to motivational interviewing. Let's focus on examples that relate to oral health. And let's not forget our 5 pillars, which must be embraced through motivational interviewing, including expressing empathy, dealing with resistance, handling discrepancy, supporting self-efficacy, and developing autonomy, or helping the individual to develop their own autonomy. So, the interview. How do you begin? Remember, open-ended questions. Tell me about your oral health routine, or how do you view your oral health? Inspire the person to speak about their own experiences and ideas. And remember, OARS, O-A-R-S. open-ended questions, affirmations, reflective listening, and summaries. Identify the problems or problem. Remember, let the individual discover the problem rather than suggesting it yourself. In this case, when we talk about oral health, it may be something related to a missed oral health behavior or a negative behavior, such as smoking. So the problem, what will this sound like? Well, I don't floss enough. I don't brush or care for my teeth. I could have a better diet. I know I need to quit smoking before it kills me. I barely think about my teeth until they hurt. What not to say? Gross! Doesn't that taste terrible? You need to do better. Think about your future. Why don't you brush them? Hasn't a dentist ever told you you should start? What not to do? Well, sometimes it's not just the words we say. Facial expressions, tone of voice, body language, these will all tell the person how you're feeling. So, focus on being positive, avoid that grossed out look or facial expression, focus on no judgment and helping the individual to find their way to success. What are some of the optimal responses? Remember, tact, T-A-C-T, compassion, empathy, avoiding conflict, promoting self-efficacy, and dealing with resistance. Wait a minute. Are these starting to sound familiar to you? Yep. Yes, they are. The key pillars of motivational interviewing. So what are some of the optimal responses? I understand. What might you do about this? I think it's great you want to change for the better. That's a great suggestion. I think you have a good solution. You are very strong for taking this step. And the optimal response? As I've said, positive, empowering attitudes. Embrace kindness and optimism. Cheer on successes and steps, even little thoughts, in the right direction. Remember, change is hard. Have you ever needed to do that? Lastly, don't forget, place yourself in another's shoes. Do not forget that existing uncontrollable factors such as health disparities and cultural differences may serve as complex barriers to positive change. Place yourself in another's shoes just for a minute, and that will really help you to serve as the best possible guide. Changing behaviors is no walk in the park. Expect hang-ups, fallbacks, barriers. And on your hand, don't expect to be the perfect motivational interviewer the first time you try. It's all a learning process for both you and for the individual. But doing the best you can will certainly help others to step in the right direction. Importantly, do not lose hope and ensure that you follow up if you can. I know this isn't possible in all settings. However, it really, really is important in this case. Motivational interviewing is a fantastic tool for promoting self-change. However, knowledge of oral health, health disparities, and cultural differences is key for successful, effective motivation and interviewing. Could a greater miracle take place than for us to look through each other's eyes, even for an instant? Henry Thoreau. Thank you to our sponsors. We hope that you enjoyed this lecture on motivational interviewing. With any questions, please contact us and we will see you next time. Thank you.